Cox Cable, Oklahoma City.
Good evening, Oklahoma, and welcome to another edition of Gay News Break. This week's top stories include drug setbacks for an AIDS vaccine, and gay activists fear that Jesse Helms may cause some problems with the new health reform bill, and a gay Air Force pilot is reinstated after he was discharged. Researchers claim that drug setbacks are dashing the hopes of an early AIDS vaccine. Recent AIDS drug failures have led U.S. experts to believe that a search for a vaccine is as remote as ever. But the director of AIDS research for the World Health Organization says there's some exciting news that AZT can prevent transmission of HIV from mother to child. Researchers have confirmed that AZT offers only small benefits to adults already infected. The head of the research company that produces AZT says that there may never be a simple cure. The research director says that a combination of drugs could be developed to control AIDS in the same way that insulin injections control diabetes. Some drug firms may halt all AIDS research if new classes of drugs currently being screened fail to deliver. A Virginia Unitarian church says there's more to the First Amendment than just freedom of religion. The church is protesting the ban on a gay publication by the Fairfax Board of Supervisors. The chairman of the board is ordering county employees to keep their hands and eyes off the gay publication. The chairman says the paper advocates sodomy and is against Virginia law. A church spokesman disputes the claim, saying that you can't assume that either homosexual or heterosexual county employees violate the law just because they read the newspaper.
Without fanfare, publicity, or controversy, another lavender ceiling has been shattered. A black lesbian law professor from New York became the nation's first openly gay federal judge. 47-year-old Deborah Batts was sworn in as a federal district judge in Manhattan after winning Senate Judiciary Committee approval and confirmation by the full Senate the following day. Batts was nominated to the bench by President Clinton last January, a year after her name was proposed to the president by U.S. Senator David Moynihan. According to a spokesperson, Batts was confirmed by voice vote, and there was no record of any senator expressing opposition. Her confirmation was in sharp contrast to furious opposition expressed by the radical right to Clinton's nomination of another open lesbian attorney, Roberta Achtenberg, to a high position in the U.S. Department of Housing and Urban Development. Batts is a graduate of Radcliffe College and Harvard Law School. Gay rights activists on Capitol Hill fear Senator Jesse Helms and some of his allies are going to attack the health care reform bill. The reform bill has a provision in it that would protect gay men and lesbians from being denied medical services, provided substandard medical care, or being otherwise discriminated against in medical care. The bill was introduced by Senate Majority Leader George Mitchell, a Democrat from Maine.
Alabama's State Attorney General is questioning whether or not to support sodomy. The Attorney General is asking the question now that he is the defendant in a lawsuit brought about by a University of Southern Alabama student group. The gay students are asking for an equal share of their student organization school funds. The Attorney General has denied the funds because, according to the Alabama Civil Liberties Union, gay students have no interest in activities other than sex. The former chairman of Oklahoma City's Human Rights Commission believes that current council members are afraid to stand for anti-discrimination for fear of harm to their political careers. Former Chairman Bill Rogers blames current council members with the failure of the city to enact anti-discrimination ordinances. Mr. Rogers says that one council member, Mark Schwartz, is holding the civil rights of all minorities hostage because of his fear of advocating human rights for gays and lesbians.
Over 150 gay and AIDS leaders from across the United States and Canada met in Dallas for a historic summit to address the crisis of new infections occurring gay men, bisexuals, and lesbians at risk for HIV. The summit was the first of its kind and was sponsored by the American Association of Physicians for Human Rights. Summit participants expressed particular concern about reports projecting that a majority of young uninfected gay and bisexual men in the United States may eventually contract HIV. Attorney Benjamin Schatz, an organizer of the summit, said the meeting was called to reawaken the community to the severity of the problem with new infections and to place the issue at the top of community and national agendas. The 10th International Conference on AIDS is being held in Japan this week. Scientists, physicians, and AIDS activists from around the world are meeting to discuss the latest in research and treatment of HIV and AIDS. On Monday, well-known AIDS researcher Dr. Anthony Fauci gave a presentation on understanding the action of AIDS and for developing effective therapeutic interventions against HIV disease. On Tuesday, 3 other American scientists released new data from studies in chimpanzees that showed development of a protective vaccine using an inactivated or weakened form of whole HIV-1 could be possible. HIV-1 is the virus that causes AIDS. Hello, I'm Paula Hand reporting to you for Gay Newsbreak, and tonight we're in the office of Michael Harmon, who's the Executive Director of CarePoint. CarePoint is a recent subdivision of the HIV/AIDS Coalition and is now its own separate entity, which is very new to the Oklahoma City area. We're meeting with Michael this evening to find out a little bit about CarePoint and what kind of services they provide. Michael, would you like to tell the community exactly what CarePoint is?
Sure. CarePoint is a consortium of AIDS resources and education. CarePoint was founded originally by the Oklahoma City Area HIV/AIDS Coalition and has become its own separate entity or its own Title II Care Consortium effective April of this year. So we're real excited about that. CARE, the acronym, stands for the Consortium of AIDS Resources and Education, and POINT is that it signifies that we are a major point of entry into Oklahoma's HIV service delivery system.
What does that mean exactly, to be a point of entry?
In the state of Oklahoma, you have the Care Consortia is broken out into 2. One is the HIV Resource Consortium in Tulsa. They serve area code 918, all of the counties, the 23 counties in area code 918. And CarePoint serves all of the 54 counties in area code 405.
Well, that's quite a bit of the state to cover. How much manpower do you have in order to provide all these services?
Right now we have 6 on the staff, 4 full-time and 2 part-time. We're very fortunate in this year's contract to have a full-time rural outreach specialist who concentrates out in those communities that are outside of the metropolitan service area in helping individuals access our services. He is Dennis Green. In fact, he is down at Lawton this evening as we are speaking, meeting with the Southwest AIDS Network Board of Directors. We also have a half-time outreach specialist, Tina Alfonso, who spends her time helping women and children reach our services, and then we have Nick Porter, who deals primarily with people of color.
Now, exactly what kinds of services does CarePoint provide, and are they all provided by the people that staff the CarePoint office, or exactly who are they provided by?
Our primary programs under the Ryan White Title II contract are prescription assistance for clients who are eligible, and eligibility is based upon income. It's 150% of poverty. So we're probably purchasing somewhere in the neighborhood of $5,000 to $6,000 per month in prescriptions for individuals who qualify. We also serve in the area of transportation to medical care, where we use cabs and buses and volunteers to transport people to medical appointments or to the pharmacy, for example. Those are the two primary programs under the Ryan White Title II contract. In addition, we provide information and referral services where we refer clients to various resources where we link to a number of different agencies. In addition, we're funded by a Centers for Disease Control grant to do HIV prevention education, primarily to men of color in Oklahoma City. So we have an HIV prevention dimension to our services. Presently, to solidify ourselves as a true consortium, we have memorandums of agreement with approximately 15 different agencies and entities where we go in and sit down with the other agency and we define what services we provide, what services they can provide, and then we collaborate and work together where we refer clients to that agency for certain needs. That agency then refers clients to us for certain needs. That helps take the limited resources that we find ourselves with in Oklahoma and spread them out more wisely, and it provides a better means of service to Oklahomans.
Well, it sounds like quite the program. I think we've talked enough about CarePoint. It just occurred to me that really I'm not so sure that all of our audience knows who Michael Harmon is. So why don't you tell me a little bit about yourself, tell us a little bit about yourself, what some of your background is, and how you came to being interested in doing the work you're doing.
Well, I have a very interesting career that spans probably 3 different entities. I spent 9 years in the corporate community as a middle management person with Southwestern Bell Telephone. Most of those years were down at Durant. That's how the natives say it. And from there I went into higher education, finished my undergraduate work in business administration and management, and spent 10 years on the staff of Southeastern Oklahoma State University, primarily in continuing education. 2 years was spent as the executive vice president of the Durant Chamber of Commerce, and then left Durant in 1988, came back to Oklahoma City and entered the nonprofit world, where I was Director of Development and Planning for Mount St. Mary High School for a little over 3 years. From there, went on to Omniplex Science Museum as Director of Membership. Saw in the paper an ad that was related to the Executive Director position at the Coalition. And I found myself at this time in my life, call it a midlife crisis or whatever, I found myself really wanting to take my skills, my talents, my gifts, and use those in a way in nonprofit work that could make some difference or better a particular cause or situation. And I personally have lost several friends to AIDS and thought of no better cause to utilize my skills and applied for the position, and through a course of an interview process was selected to become the first executive director of the Oklahoma City Area HIV/AIDS Coalition, and then subsequently, when CarePoint became a reality, just shifted over into that position.
Well, Michael, we're awfully glad to have you with the community. If there's anyone in our viewing audience that needs more information about HIV and AIDS or about CarePoint in particular, how can they reach you?
They can reach us by calling our Metropolitan Oklahoma City number, 232-2437. An easy way to remember that is 232-AIDS. We also have a toll-free number that people throughout the state of Oklahoma can reach us, and that number is 1-800-285-CARE, C-A-R-E. I looked at our programmatic results over the last 4 months, and we have served approximately 170 clients since the beginning of April. So we're serving about, on the average, about 45 individuals per month with our services, and that is growing because for the last 3 months we've picked up approximately 25 new clients that we had not previously served. That's sad, but there are lots of folks out there that have HIV or AIDS. In fact, in the state of Oklahoma, a little over 2,000 people have been diagnosed with AIDS, as you know, and we're looking at over 1,460 individuals that have tested positive with HIV. So The numbers seem to be slightly on the increase among females and adolescents, and we are here to serve all of the citizens that are infected or affected by this virus throughout the area code 405. So please give us a call. If we cannot help you, we will point you in the right direction.
Okay, Michael, thank you very much for letting us be with you here this evening. Talking about Cincinnati going red has nothing to do with their baseball team. After Issue 3, the Cincinnati Anti-Gay Initiative passed, the city is facing the same plight as has been faced by Colorado, the loss of significant revenue. Because of the discriminatory action, numerous major conventions have pulled out of Cincinnati already, and others have plans to join them. The Cincinnati Convention and Visitors Bureau reported that to date, more than 22,000 convention delegates and all the money they would have spent is history, leaving Cincinnati in the red financially. Among the conventions that pulled out were the American Library Association, the American Historical Association, and the American Speech, Language, and Hearing Association. A city spokesperson said they are hoping a judge's ruling on the unconstitutionality of the measure will make the others stay put. The Colorado Supreme Court heard oral arguments in the fight over Amendment 2. Amendment 2 is Colorado's statewide anti-gay initiative that was passed in 1992. The state took the case to the Supreme Court after losing in district court last December. Most legal observers predict the state Supreme Court will rule much as it did last year when it approved an injunction against the initiative. That opinion, given in July of 1993, ruled that the initiative violates the fundamental rights of gays and lesbians to participate in the political process. In order for the initiative to survive, the state must prove it has a compelling interest to treat gays and lesbians differently than other Colorado citizens.
A gay Air Force captain will get to continue to aim high. Captain Luther Turner was being discharged for being convicted of sodomy and going into a gay bar. But according to the Air Force Times, 2 testimony tape recordings were discovered missing. The Air Force is forced to discontinue the discharge because of missing evidence. The 30-year-old pilot is being retained despite the conviction. The IRS is planning to support its own gay and lesbian employees. An IRS committee is developing a new policy to create an IRS workplace that includes and respects and fosters gay and lesbian and bisexual employees. The Service is also planning a 1995 AIDS education program for all of its employees.
In an interesting move, the City Council in Oberlin, Ohio, has voted to put a pro-gay ballot measure on their November ballot. The City Council's decision is a welcome sign to many human rights activists across the country who have been fighting to prevent anti-gay initiatives from being put on the ballot measures in November. The early notice will give activists in Oberlin plenty of time to organize and educate Oberlin's citizens. Other cities in Ohio are not faring quite so well. According to Mandy Carter, a human rights activist with the National Gay and Lesbian Leadership Forum, a radical right organization based in Ohio is planning a media blitz. The American Family Association has plans to distribute 60,000 copies of a video called Gay Rights, Special Rights. The group used the video successfully to implement an anti-gay initiative in Cincinnati. The group announced their plans to target Toledo, Columbus, Dayton, Youngstown, and Cleveland. During a press conference, Carter said they will not stand by and watch the radical right try to drive a racial wedge between the black and gay communities. The Leadership Forum plans to expose the right wing's plans for Ohio and prevent it from spreading.
How would you like to pucker up for a protest? Well, more than 75 San Francisco lesbians recently staged a kiss-in protest at a local lesbian bar. The Avengers, as they are called, staged the ruckus to protest the bar's alleged request that 2 patrons refrain from kissing. Even as California is in a state of bankruptcy, the new budget proposes dramatic increases in aid services and funding. California Governor Pete Wilson has signed a proposal that will give the state's HIV/AIDS budget its first increase in 5 years. The budget is an increase of $5 million, which will be targeted for prevention, education, and anonymous testing programs. California will now be spending more than $80 million a year on AIDS and HIV services. And now we would like to take you to this week's Moments of Reason with Phil Byram.
I had a topic all picked out for tonight. Had a little bit of time to kill before I had to show up here at the TV studio. And I made the mistake of doing one of my favorite things. I read the Daily Oklahoman. You know, it never ceases to amaze me, the editorials and the columns that you can find in there. And to be honest, it always inspires me to try and apply a little bit of reason. Tonight, the column that was in there was moaning and woeing about the decline of American family values again. The person was reflecting back on the United States Constitution and letting everyone know that the Founding Fathers were very religious Christian folks, and therefore the Constitution was based on Christian values. And the honored Bill of Rights was the same. It was based on Christian ethics. And then the person started to talk about how, as time went on, those sacred documents have been twiddled and fiddled with by organizations like the ACLU and the Gay and Lesbian Political Alliance, and no doubt the NAACP and others that they had in mind. So let's stop for a second and back up, if you will, with me to those times. America should have been at the peak of its religious ethics. The whole country was together. They created the documents, those wonderful documents, and then what followed? How about the importation of slaves from Africa? How about the near extinction of the Native Americans? The importation of Asians to work on the railroads? And then that wonderful event that divided the country into two Christian camps where brother fought brother and slaughtered each other. So yes, there's probably a lot of twiddling and fiddling been going on with those documents ever since they were first written down. And I have to ask you to think why that happens to be the case. Why was it changed? You know, every now and then I see this favorite little bumper sticker of mine. It says, "Hate is not a family value." It's a wonderful thought. Except that I started thinking about it the opposite way. Hate is a traditional family value against people that are not the same. So perhaps the Constitution and the Bill of Rights were based on Christian ethics. But thank goodness someone has been twiddling and fiddling with them ever since.
The Boy Scouts of America are in the news again for discrimination against gays. A California judge awarded $5,000 to a Boy Scouts leader who was expelled after revealing that he is gay. The judge's ruling states that public acknowledgement of homosexuality does not translate into the teaching that homosexuality is proper or improper. The judge also declined to order a reinstatement of the leader. The Boy Scouts of America have a national policy banning gays from being leaders and plans to appeal the court decision. Normal people were refused to march in San Diego's Gay Pride Parade and now are filing a lawsuit against the organizers. A group of heterosexuals calling themselves normal people wanted to march in the parade to protest the gay political agenda. The group filed a lawsuit to try to keep the Pride Committee from banning them. The complaint also states that Pride organizers broke San Diego's Human Dignity Ordinance by discriminating against the group based on their sexual orientation. Gay Pride Committee's attorney says the exclusion has nothing to do with their sexual orientation, but it does have everything to do with their message, their viewpoint, which is contradictory to the parade's message and viewpoint.
A 6-month study of 18 lesbian couples found no incidence of HIV transmission from one half of the couple to the other, even though one partner had HIV. The report, which was released earlier this month, has AIDS activists up in arms. The study was done in Italy and released to the British medical journal The Lancet. Researchers said they found no evidence of HIV transmission between two partners, even though they both engaged in high-risk sexual behavior. Activists here say other factors should be looked into, including whether 6 months was long enough to make a determination. One female researcher in the United States was incredulous about the findings. She said she couldn't believe she was the only person to know several lesbians who had contracted HIV through lesbian sex. A spokesperson for the National Women and HIV/AIDS Project said the study appeared to have several flaws, and reporting its results could be dangerous. The U.S. Assistant Secretary for Health said the federal government will not lift the Bush administration's ban on medicinal marijuana. Citing a lack of scientific evidence, the Assistant Secretary said the U.S. Public Health Service will not reopen the single-patient investigational new drug program. The program allowed individual patients to legally use marijuana to treat AIDS wasting syndrome and other disorders. He did say, however, that the Food and Drug Administration will consider approving clinical trials of medicinal marijuana. A spokesperson for the D.C.-based Drug Policy Foundation said it plans to provide funding for such a trial. And that's it for this week's segment of Gay Newsbreak. We'll see you all here next week.